not prepare adequately for them in terms of storage and transportation. These are very sensitive, vaccines that need to be, protected and what do you call it now?
Preserved.
Safe, and transported in very special conditions. Do you think that we have the capacity to manage that? Do you think that we, as a nation, as it is with the bad roads and all that,
these vaccines would be safe enough for Nigerians when they arrive here? Because they could arrive here, and they're very good. What's the guarantee that when they get here, before the period that people get inoculated or take the vaccines, that these vaccines will still be safe?
Okay, so I like to point out that this is not the first vaccine Nigerians will ever receive, or anyone across the world. Just the way other vaccines have been handled is the same way this one is going to be handled. Just that most vaccines have always been for children, with some exceptions like hepatitis vaccine. But we have always had the capacity for storage of vaccines. We may only need to increase our capacity. Now, yes, there have been concerns about how to store the vaccines, or when they arrive, are we going to keep them? Vaccines need to be kept at a particular temperature because, like I said, they are genetic codes. Some are live vaccines, so by the time you are giving it to the person, it should retain its potency. So before even getting it, the government is really trying its best to make sure everything is in place for the arrival of the vaccine. I think we'll be able to handle it.
That's one level of assurance. We would be able to, or we should be able to handle it when it arrives. Now, another concern would be that what are the long-term effects? People are saying, we don't know if these vaccines are safe enough. We've had several diseases that have been there for many years, and you haven't been able to vaccines for them. How come within a short period of time COVID-19 vaccine is ready and we would be taking them? How safe are these vaccines as it is?
Okay, I'd like to point out that vaccines typically require years of research and testing before reaching the clinic. That's before reaching when you start administering them to people. But in 2020, last year, scientists embraced to produce safe and effective coronavirus vaccine in record times. There has been no record of a very fast vaccine that has been produced like that. Currently, there are over 68 vaccines in clinical trials on humans. Clinical trials means it has passed the preclinical stage. 20 have reached final stage, and about 90 preclinical vaccines are under active investigation in animals. Now, these vaccines that are being produced, before it reaches the clinic, from the manufacturer stage, the Food and Drug Administration has to assess the safety of the vaccine. And then it goes through a very rigorous set of standards. Even after the Drug Administration has determined that, okay, this vaccine candidate is safe and effective, now the Advisory Committee on Immunization Practices has to also make recommendations to the Center for Disease Control as to how to give the vaccine, who to give the vaccine, the safe age limit for the vaccine, priority cases for the vaccine. So vaccine someone does not just stay and then make it and start to give people. It goes through different sets of standards. It goes through rigorous checkpoints before it is recommended for people to take. Now, COVID vaccine is no different from other vaccines that have been administered to people. People have fears, but what I say is that most of them are baseless. Most of them are assumptions. Most of the people coming out with videos making a mockery of the hard work that people are putting on ground to bring an end to the pandemic do not have any scientific basis for what they do. Yeah, I know most of us in Africa or Nigeria see videos of light-skinned people or Caucasians saying some things, and then sometimes we just see, because this person is from the Western world, I feel is intelligent. But no, it is not like that. Most of them are making baseless assumptions that does not even hold anything to it. But because these vaccines are really going through different stages to make sure that they are safe, people have concerns. But yes, like with every other vaccine that have been in use, they also have side effects attached to it. But the side effects you get from a vaccine is not as severe as the side effects you get from contracting the disease. There are always acceptable limits of side effects with every vaccine, and then most of them are also reversible. There was a presentation made where most people got that idea of the side effects with COVID vaccine, where they said about 3,000 people got side effects and but it was even reversible. So there are side effects, they are within the accepted limits of side effects, but you can never compare the side effect from a vaccine with the side effects of the actual disease. And COVID-19 vaccine is not the first to have side effects.
Okay, so other vaccines may have side effects. I remember when we used to take the what do you call it?
Polio.
No, the meningitis vaccine, and after taking the
couldn't
vaccine,
lift your arm.
Yes, and you know there's this weakness in the arm.
Yes.
Some people experience fevers and all. So those are you know,
and that is a normal reaction after taking a vaccine, because when you start to have those fever and those other signs and symptoms, it is your body that is responding to the vaccine and trying to build itself up, preparing itself for when you get in contact with the pathogens. So the body's response to a vaccine is kind of a normal reaction. Same thing with the oral polio. After giving children, you see they tend to have fever. It's a normal response to a vaccine. The body has to react. Yes, something has come in. Okay, I'm bracing myself up for when something comes. So it's a normal response. And again, the issue you mentioned about other diseases that have been around for a while and they haven't gotten any vaccine for it since then. Specifically, people have mentioned HIV, that the human immunodeficiency virus has been around for decades and nothing has been done about it. And I always mention HIV is a chronic illness, does not kill as much as COVID has been killing people, because HIV has medications that when you take for life you are covered as long as you are regular on your medications and follow up. COVID-19 does not have a treatment. COVID-19 is a short-term illness, unlike HIV. When HIV came, technology had not advanced as much as it has now. What went on in 2020 that led to the provision of this vaccine is something that has never been done. Series of scientists and researchers, usually research is being done sequentially, after one phase, then another phase, then another phase. But this time around, they all came up and things were going on simultaneously in different countries. They had a template ready. They just need to put the genetic code of the virus to come up with something. So many countries are doing it now, trying to come up with their own vaccine. So technology has advanced. It's not like the time of when they had HIV. Technology has advanced. Also, HIV has not stalled the economy of the entire world as COVID did last year. So COVID is more of an emergency. People have not died so much in a short time of one illness in recent times the way people have died from COVID. Hence, they need to produce the vaccine so swiftly.
Nice. Yes. Given all that analysis, these are quite good, solid reasons why the vaccine could have been produced in such short time. Now let's talk about testing before receiving the vaccine. Some people are saying, how do you know that you don't have the virus already, and then you're adding more virus to your system, as it is by taking the vaccine? What are we doing around testing and vaccination?
Ideally, the vaccine is available from 16 years of age. The younger than that do not really need the vaccine, and then it is in quotes safe for everyone. But then those that should hold on to getting the vaccine for now, say the vaccine is available today, those that have had the disease should wait for a window period of 90 days, 3 months before getting the vaccine, which I also say is not something new. Even with hepatitis, you also get tested. If you have it, you hold on before getting the vaccine. Same thing with COVID. If you've had the disease, the COVID, you hold on for 3 months before getting the vaccine. That's why before the vaccine, you have to get tested. If you are positive, you hold on for 3 months, 90 days before they give you the vaccine. Otherwise, if you've had it in the past 3 months, 3 months has elapsed, you'll get the vaccine. So there's a testing being done. Those that are actively infected won't get the vaccine until after the 90 days window period.
So that means that before you take the vaccine, there is need to be
get tested. Yes,
before taking the vaccine. Now, you made mention of something when you said mentioned the FDA, Food and Drug Administration. Now, in Nigeria, we have NAFDAC. It is supposed to be that every medication or food that comes into this country is examined by NAFDAC. Now, we're seeing that NAFDAC, to an extent, at some point said the virus, the vaccines would not be tested because, they've been tested and, and all that stuff coming into this country wouldn't be a problem. When they come in, people should just, people would be inoculated without, having to, screen the vaccines, clinically in Nigeria. Do you think that's a good thing?
That is because the vaccine we are getting, everything is under the umbrella of WHO, the World Health Organization. It has gone through rigorous screening processes before they even think of bringing it here. The first dose we are receiving is actually kind of a donation, and it has gone through that screening process. Hence, there's no need. That's why NAFDAC are saying what they are saying, because it has already been screened by a higher body, and then even the health system of Nigeria is under the WHO umbrella. So whatever they are giving us is safe.
Okay. Now, priority for vaccination. We're seeing other countries where they're saying, frontliners are going to be a number one priority, and then the elderly, the older people would follow. Do we have such a structure in Nigeria? What are we doing as regards that?
Yes, we also have a structure. There has to be a structure. There have to be a structure because the vaccine is in short supplies. Globally, there's a short supply of the vaccine, so we have to put something in place to be able to distribute it. Frontline health workers. In fact, we can't even take all the frontline health workers, but then there are some key people that have high risk of contact with people, like frontline health workers, like some immigration officers at the airport, some security personnel like policemen, the elderly, some people with chronic illnesses within the age of 16 to 64, that is used to middle age with chronic illnesses that may put them at risk of contracting the disease more, are also people that are in the should be given priority. So basically, that's just it's same with what is obtainable anywhere else.
Okay, so we know it now. Also, some of the concerns are around the prioritization of the vaccination process and all. There were concerns or talks around the country about how the president and some of the people in his cabinet will be first to receive the vaccine. Then some of the Nigerians are saying, why do we have to vaccinate these people first? Are they more important than other Nigerians? How do you react to that?
Okay, there's a word about strategic leaders also being the first man in every country is the president. The president is also priority because he steers the affairs going on. If we bring vaccine and we don't give the president, who should be the first to get it? So I believe he's also priority, and decision makers, key decision makers, because in the first place they are the ones helping to even bring it in. So we need to protect them too. Hence the need for them being in the priority group.
Okay, so over time around vaccination, we've had religious and traditional concerns. Some religions and all, some people don't believe in vaccination and all. What would be the best message for people like that at this time?
Well, from what I have seen or what I can say about this is the vaccine that we are trying to get is safe. There's something they call halal or haram, but this vaccine, like we're trying to get the Pfizer vaccine, and some people have speculations that it contains animal products, which is not true. It is safe. It has been branded by the British Islamic Association as halal, so it is quite safe for anyone to get. So there's no hidden anything about it. It's safe, and it is okay for everyone to take.
All right, you say it's safe, and so we would take a break now. When we come back, we would be getting to hear from you. If you've been listening and following the conversation, it would be time for us to bring you in fully into the conversation. Share your thoughts and questions with us on the program this morning. Right after this commercial pause, stay with us on Invicta Night, April 9. The program is Perspectives. Welcome back to the program. It's Perspectives on Invicta 98.9. This morning, we're looking at the COVID-19 situation in Nigeria, being proper focus on the COVID-19 vaccine and the update and what's happening with that in Nigeria. As it is, our guest has been Dr. Salamatu Ako, representative, Risk Communication Pillar, Kaduna State COVID-19 Response Team. She's a senior dental officer, Dental Center, Kaduna State University. If you want to join in the conversation now, please call us on 081 40,000 989 081 40,000 989 or 070 87 800 989 070 87 800 989. You can send a WhatsApp message to 090 989 00989. The COVID-19 vaccines may be arriving in Nigeria soon, as we have heard from the federal government. And how prepared are we? And what needs to be done is all we've been talking about on the program this morning. Let's take this call. Hello, good morning.
Hello, good morning.
Good morning. What's your name?
Yeah, this is Muhammad Shehu Yusuf calling from Tudunwada here.
Muhammad Shehu.
Yeah, Yusuf.
Yusuf, go ahead, please.
Yeah, I want to say good morning to our guests. Yeah.
Good morning.
Yeah, good morning, Mas. My question goes to still that COVID-19 vaccine. And I heard that the vaccine will come over to Nigeria very soon at the rate of 400 billion naira. Yeah, that's not the case. It's a very good move. Actually, my question is, what about those people that are diagnosed with some disease like hepatitis, HIV, diabetes? Can they be able to receive the vaccine? Yeah, that's my question.
Okay, thank you very much. Quite great question there, Yusuf. Thank you for asking. We're taking more calls on 081 40,000 989 070 87 800 989. Hello, good morning.
Hello, good morning.
Good morning. Welcome to Perspectives.
How are you?
Very well, thank you.
I'm Luca Adra calling from Malabarido.
Luca Ada, go ahead.
Yeah, your guest has spoken well.
Okay.
Just like what the first question asked, I'm in line with his questions. But what I want to also add here is, absolutely the governor of Kaduna State, since his assumption into that office, he has been actually trying everything. In fact, in this country, among the 36 states, is always the first. Mm-hmm. And what I want to say here is, with regards to this vaccine, will it be properly handled from the manufacturer to the consumer very well? Do we really have the gadgets at least to handle this vaccine very well? That is one. Two, there's always dubious human beings that will always have around. Sometimes you find out this vaccine in the private hand. Let's say the private sector would, of course, vaccine is supposed to be in the hand of the government, not in the private hand. But sometimes you find certain vaccine in the hand of the private people, which I think is not supposed to be, because some of the private organizations don't even have the facilities for the storage of this vaccine. I think the government should handle this in proper. So I expect that The governor of Kaduna State, who is hardworking, at least this thing should be handled very well. And most of our staff, at least that is the health staff, that are shared out this responsibility should be properly trained and be properly handled so that this thing will not get out of hand. Have a nice day.
Thank you very much, Mr. Ada, for calling in. We're still going to take another one. Hello, good morning.
Hello, good morning, friends.
Good morning. Welcome to Perspectives.
And good morning to the doctor also there at the studio.
Good morning, sir.
My name is Comrade Gabriel, the federal man. What I wanted to say that while the state government, the federal government are trying to contest this COVID-19, today as we are speaking to you, cannot say, I don't know why the election has been done, they are preparing the election. There are so many things that is going around, and people are not trying to curtail all those things, but they are concentrating more on schools. Today, as per the news, the Minister of Health is saying different things. The federal government, he was saying that they are not even prepared to open schools. Now, the state government is insisting that no school should be open. So, why can't they connect this so we'll be able to know that we have a focus? That's very, very important. Let us have a focus. If the schools are not going to open, let it be general. If they are going to be closed, we know that they are closed. So that everybody will be safe. She is saying that the vaccine, for example, they are coming. We have almost 58 samples and about 20 have been approved as discussions. And they are warning us that there are fake vaccines circulating around. How are we going to be sure that most of these vaccines have not gone into the country through dubious manner? So I think we want this question so that everybody will say, for me, the state government in data and the doctor at the studio, in fact, they are trying their best. The Almighty God protect us all in Jesus' name.
Thank you very much for calling, Comrade Gabriel. Before we take the next call, Doctor, you want to respond to some of the questions? Mohammed Yusuf was asking about people who may have contracted other diseases such as HIV. Would they be taking this vaccine? And those, Luca Ada is talking about, the vaccines in private hands and the private sector. And the facilities to manage, the vaccines and especially in storage. And then Comrade Gabriel came in with concerns about illegal importation of the vaccines and, the vaccines being in illegal hands or coming in through the back doors.
Okay, let's start with the first one. He mentioned those with hepatitis, diabetes, and some other illnesses. Well, we call all those underlying medical conditions. And as I mentioned earlier in the priority group, now we have the elderly, we have the other group from 16 to 64 with underlying medical conditions. And all these illnesses he mentioned fall under the underlying medical conditions. Before the vaccine got to the clinical stage, we had, some volunteers came and then tested the vaccine, and that's exactly how they were able to come up with it. So many people with these underlying medical conditions volunteered to get tested with this vaccine before it was approved. So even these people with these underlying medical conditions are also safe and eligible to get the vaccines. And then coming to the statements the second caller made about the storage of vaccines, we won't be getting those vaccines if we don't have storage facility in place for it. If the storage facilities are not in place now, they are still being prepared. The government does not want to fail at this, so we are also trying our best to make sure everything is in place for this vaccine to be safe for administration to individuals. And then with about the dubious people or the vaccine in private hands, we are taking let's say the United States, for example. In the United States, there are only 2 vaccines that have been approved, and that is the Pfizer Biotech and then the Moderna vaccine. Other vaccines are also under the 3rd stage of trials, but like in the US, there are just 2 vaccines. I mentioned that there are about 68 vaccines that have passed clinical trials, but these vaccines are in different countries. India has its own vaccine that is being produced. Brazil has. Mexico does not have, but they are getting from another country. Same with Australia. China has its own vaccine. Russia has its own vaccine. Israel has its own vaccine. But we are not getting from those people. We are trying to get the biotech Pfizer vaccine that is being then donated to us. And that vaccine is safe. So it is a duty now of individuals. When you're getting your vaccine, you know what you are being given. And then you make sure you are going to government approved centers to get the vaccine when it comes. You don't cut corners or try to go to private facilities to get vaccine when you know that government has not given those people vaccines to give to administer to people. And then with the issue of schools also, deliberations are still being made about opening schools. Now each state has its own individual capacity. Yes, the federal government has a task force, but each state has its own task force. They know what they can handle. The state knows how many beds they have in their isolation or their treatment centers. The state knows, oh, we can handle this and we can handle that. If the federal government say, oh, schools can open, and the state knows that we do not have the capacity to do that, it is at their discretion to open or not to open schools. What is the point of rushing to open school or yielding to pressure, and then you open schools and then you become overwhelmed and you don't know what to do, or then you open the school and you now close it again? Some must say, oh, let's open and then see how far we can go. Or what is the point of opening and seeing how far you can go, and then you fail and you then close again? Then it becomes chaotic. So it's better to put things in place, see what it is that we have on ground. If we can open, we open. If we think it is not safe, the last time I did a program, I was telling someone, I said it is better that you are looking at your child alive at home than to have your child going to school and then falling sick or die. Which is better? It's better to have your child with you than say you want education, and then things are not going well. So that is what the government is trying to do. The government is not against anybody. Whatever they are trying to do is for the benefit or the common good of everybody.
It's all for the greater good and for the common good of everyone. I will take more calls now. 081 40,000 989 and 07087 800 989. Before we get to the call, I'd love to ask this question, and then some people are concerned about the span, or the lifespan of the vaccine. How long would it last in your system before you'd have to take another one? Like we used to have meningitis vaccine every year, and then at some point we had the 10-year one. Would it also be the same? How long would it last in your system before you would need to take another vaccine, or would it be a lifetime or once in a lifetime vaccine?
So like for this vaccine now, let me speak about the Pfizer and the Moderna. Like the Pfizer vaccine, after the first dose you have 54% immunity against the virus, but after the second dose you have 95% efficacy against the virus. For the Moderna, and they are given at 2 weeks apart. For the Moderna vaccine is given at 4 weeks apart, and then after the second dosage you have 94% efficacy against the virus. Now, as COVID is a new disease, so also the virus is a new disease. We haven't suffered from the disease for 10 years to know the lifespan, but things are still in place to get more information. Every day we keep gathering more information about the vaccine, but for now we know where we take it, we are protected against the vaccine.
Right, let's get back to the calls now. Hello, good morning.
Hello, good morning.
Good morning, welcome to Perspectives.
Thank you. Good morning to the in the studio.
Good morning, sir.
Thank you, my Francis from Marabango.
Francis, thank you for joining us.
Thank you. Honestly, I can see that the health sector is on top of the situation, especially when entertainment. But there's something that doctor said in the video here that I am not more comfortable with, and that is when you ask her about NAFDAC's opinion about the vaccine, that they are not going to subject it for another verification if the vaccine arrives. I somehow, in fact, I'm uncomfortable with that, because for the fact that the World Health Organization have trained the vaccine and ratified it, as a nation that has their own independence and a sovereign nation, we're supposed to confirm it. We're supposed to confirm it for the citizens of this country to also have trust on the vaccine that they have brought or they are bringing in. But for them to just give us such free will acceptance on the vaccine, most of us as Nigerians, Nigerians will not be able to accept it, because we know what is going on worldwide today. Some people accept what they believe okay for them in their own part of the world, and some reject it because they are not sure of it. So I plead with our health personnel. NAFDAC have to verify it. If they can verify any other product that comes from any nation, why not this? they should do so to the president to assure us Nigerians that yes, them have confirmed it for which they accept. Thank you.
All right, thank you very much. That's one question there. Doctor, you want to respond to that?
I agree with you, sir, that NAFDAC should verify whatever it is that is coming into the country. 100% I agree with you.
All right, let's take another call. Hello, good morning.
Hello, good morning, sir.
Good morning, welcome.
Thank you. My name is Ahmed.
Ahmed.
I'm calling from Naria.
All right, Ahmed, go ahead.
I'm in line with the last speaker. I don't know whether the doctor is aware of what is going on about the vaccine. I think it is Zambia or what country is that said that they will expect the vaccine to be administered to these people, that they are going to make sure that they are going to use their own indigenous vaccine. That is making sure that their doctors and their scientists find out the way and how they are going to manage their own COVID-19. I've not heard anything about the country, especially Nigeria, saying anything about this. We fold our arms and keep waiting for other countries to produce this for us. Whereas there are so many people, so many countries discrediting the vaccine, and we are not mindful of this statement at all. So I'm very sure that many Nigerians will not take this when it comes, because we have been hearing about the dubious characters behind the vaccine. So I don't know whether you have opportunity to watch the video that is circulating, where some people
Ahmed, we don't want to base the conversation on the videos that we see on social media. These some of these content may be very, very unverified. I don't know if that's even a correct thing to say, but some of these videos are unverified. Some of the claims are unverified, are not been verified. So we would not base conversations on such videos. And we really appreciate you calling in. Thank you very much. Doctor, I would want to ask, the World Health Organization has representatives from almost every nation, and when the World Health WHO, as it is, certifies any medication, it means that representatives
from your country has also verified
that. Isn't that enough assurance that the vaccines would be safe for Nigerians?
Seemingly, it seems so that once a representative from a country is, and that's why I mentioned that WHO has verified or certified it safe for each country that is being given to. But then, if the citizens, the citizens of every country, they have their voice. If they say something, the government should listen to them. If people are skeptical about the vaccine, say, oh, they won't take until their own government, it doesn't cost much. The government can say, oh, the body, the food and the NAFDAC or the Food Drug Administration of your country was there, and so it doesn't cost much for the government to also do that. So it's like it goes both ways. If the people need to hear something from the government, I think it's still in the place of government to make them comfortable whatever it is that they're going to take.
All right. So we're taking more calls now on the program. The numbers again, 081 40,000 989 and 07087 800 989. Hello, good morning.
Hello, good morning.
Francis, you already called in. Thank you very much. We appreciate you calling. Let's take another caller. Hello, good morning.
Good morning.
Good morning. Welcome to Perspective. What's your name?
My name is Omar.
Mr. Omar, go ahead. Let's hear you.
Yeah, I just want to ask a question with regard to take vaccine. What are you people doing towards it has not entered into
the current expected vaccines that is coming out. We know NAFDAC is working towards verifying, but how too far is to substantive effort that work towards curtailing the fake vaccines from entering the country. Thank you very much, sir.
Thank you, Umar, for your question there. Doctor, you want to respond to that?
So the vaccines that are coming in are not open to the market. People are not going to be buying vaccines. Vaccines are coming in directly to the governments, and they will also be distributed to states, still in the hands of the government. So you cannot go to a government facility and be given a fake vaccine in the government hospital. So as I mentioned earlier, people should make sure they restrict themselves to getting those vaccines at government approved centers, and they should not cut corners or try to get it faster by going to any private facility.
Okay.
In that way, you're safe and you're sure of what you are getting.
Just to stay safe, go to government facilities where the safety of the vaccine is guaranteed. Hello, good morning.
Hello?
Good morning, what's your name?
Good morning, this is Kure.
Did you say your name is Kure?
Hello?
Yes.
Yes.
Okay, go ahead, let's hear you. You have a question or concern?
Yes. Yes, I want to comment. There's a caller that called. He was trying to say something about the vaccine. Some vaccines are being, manipulated. Let me know that. We had or seen on internet that they want to eliminate Africa, and they want to do that vaccine.
We would not take all of those, what you call them now, conspiracy theories. That's not the basis of our conversation this morning. Maybe on another program, but not on Perspectives on Invicta 98.9. We would not base conversations on conspiracy theories. Whatever isn't acceptable or hasn't been verified, we would not take. Hello, good morning. All right, we're going to take another call. Hello, good morning. Hello, good morning.
Good morning, Victor.
Good morning. Welcome. What's your name, sir?
Tunde Okoro from Alta.
Mr. Tunde, go ahead.
Yeah, I just want to applaud the doctor for explicit explanation on the vaccine.
Thank you,
I've
sir.
not been this comfortable about the vaccine until after I've heard from her.
Okay.
But there was this attraction about the closure of school that I'm not too comfortable with. Because as I speak, I feel if there's going to be a lockdown, the most unorganized place to lock down is the market. And not the organized place such as school.
Okay.
And if you move around, if you are the type that moves around, you will notice that the people are not taking the precautionary measures at all about the COVID-19. People don't wear nose masks anywhere you go to. If you check, majority of the people don't wear nose masks. And if that continues, it means the rate of infection will keep increasing, and it means the school will continue to be locked down because there will not be any relief on the infection, which will keep the school being locked down. So I think the government needs to really think about the alternatives to the closure of the school, and considering the people whose business are directly affected in the school business. That is my submission, and I want her to share a little light on that.
All right. Thank you very much. Doctor,
Thank you, sir.
over to you.
Thank you for your question. The schools will ultimately be opened, but there are some things that need to be in place before the schools are opened. There's what we call an infection prevention protocol that these schools need to adhere to. We're trying to see that these measures are in place before the schools are opened. We need parents to also put heads together with their kids and make sure they provide necessary things for their children to resume schools, like the face mask, hand sanitizers. Schools need to provide hand washing facilities. The schools need to be able to provide classrooms where children are not crowded, to ensure that they reduce the risk of spread of COVID. And then with all this in place, before they can even think of reopening the schools. Like I said before, government cannot yield to pressure and then do the wrong thing. The right thing has to be done for the safety of these children. These children have been at home for some time, but then these children can also be the vehicle for the spread of this disease. They all come to one place and go back home. Even when we say adults in the market, how many adults from one family go to a market in a day? But then you can have 5-10 children from one household in different classes in a day and every day of the week, mixing with other numbers. So it will be a very, very easy way to spread it. And we don't want to have so much numbers that we don't have capacity to handle. So schools will definitely be opened as long as these things are in place. So we are just trying to make sure that these things are in place and then the schools are open.
Dr. Salamatu Ako, Representative Risk Communication Pillar, Kaduna State COVID-19 Response Team, and Senior Dental Officer, Dental Center, Kaduna State University. Thank you so much for spending time with us this morning.
You're welcome.
All right, and well, as we close this program today, it's quite an emotional one for me because it just may be the last time you would hear my voice on the side. And as I move on to other things, I'd love to say that I want to say thank you. Thank you so much for being there and supporting me and supporting the brand and supporting Invicta Night at April 9. Let's move on, do greater things this year, 2021. It's quite an emotional moment for me. I'd love to say thank you so much again to Invicta Night at April 9, to Kaduna, and well, to everybody who has listened to me and ever supported me in this journey. I'm so grateful. Thank you very much. My name is Iheanacho Prince. Bye for now.